Welcome to the Deep Dive. Today we're tackling Coeliac Disease. It's a condition that affects about, 1 in 100 people.
Which is surprisingly common, right?
Exactly. But here's the thing. Maybe up to 80% of cases might be going completely unnoticed.
That's a huge number. Really highlights the diagnostic challenge.
So our goal in this deep dive is to understand why that is. We want to explore the often complex path to diagnosis.
And look at what might be contributing to how common it seems to be becoming.
Right. And also discuss ways to support healing that, go beyond just avoiding gluten. We're aiming to cut through the noise here.
Give you the essential insights from our sources. It's a fascinating puzzle, coeliac disease.
Yeah.
It's really not as simple as just, saying no to bread. Our materials show this deeper interaction, immune system, testing issues, even how our food has changed.
It really shows how easily it can be missed.
And why really understanding it is so important.
Okay, so let's start with how it typically shows up. Or maybe, more importantly, how it doesn't always show up like people expect. Our first source, gut check. Understanding coeliac disease, it makes it clear that while we often think of gut problems...
Yeah, like diarrhea, bloating, pain, nausea, weight loss, the classic stuff.
The reality is just much broader than that.
Absolutely. What's really key, I think, is the sheer range of symptoms outside the digestive system.
So, Jeff?
Well, things like persistent fatigue or maybe unexplained anemia, recurring mouth ulcers, joint pain, even a specific itchy skin rash.
Dermatitis? Herpetiformis.
That's the one. These might seem totally unrelated to your gut, but they can all be clues.
And in children, it can look different again.
Yeah, maybe delays in growth or what they call failure to thrive. This huge diversity of symptoms is a big reason why so many cases just fly under the radar.
It's almost like the body's sending out these sort of indirect messages.
Exactly.
And it gets even trickier, doesn't it? With what's called silent or atypical coeliac disease.
Right. So here, individuals might feel perfectly fine digestion-wise.
No gut symptoms at all.
Maybe none obvious, but they could still be experiencing the consequences internally. It might show up as, say, osteoporosis or infertility or maybe iron deficiency that just doesn't get better with supplements.
Those are the subtle signals that are so often missed then.
Absolutely. These are frequently overlooked clues. And if we link this back to the basic mechanism, the source explains that it's gluten, specifically a protein in gluten called gliadin, that triggers an immune response.
But only in certain people. Right. The ones with a genetic predisposition.
Precisely. Those carrying specific gene variants, HLA-DQ2 or HLA-DQ8. Think of those genes as making the immune system extra sensitive to gluten.
So when they eat gluten,
their immune system mistakenly attacks the lining of the small intestine. It damages these tiny finger-like projections.
Villi.
The villi, exactly. And they're crucial for absorbing nutrients.
Which explains the wide-ranging symptoms. If you're not absorbing nutrients properly, it can affect, everything.
All sorts of bodily functions.
So our second source, coeliac diagnosis and testing pitfalls, then dives into how we actually try to identify this, and importantly, where things can go wrong.
Yeah, this part is crucial.
It explains the typical diagnostic path involves blood tests, serological testing, and then usually a biopsy of the small intestine.
What's really critical to understand here are the potential weaknesses, especially in those blood tests.
Okay.
The most common ones look for specific antibodies. Tissue transglutaminase, IgA, or TTG-IgA.
And EM. Endomycyl antibodies.
Right. But here's the catch. A significant number of people with coeliac disease also have something called selective IgA deficiency.
Meaning their overall levels of IgA antibodies are just low generally.
Exactly. Their baseline IgA is low.
Okay, this is a huge point. So if someone has this IgA deficiency, their TTG-IgA test, the main one, could come back negative.
Even if they do have coeliac disease, yeah.
Because there just isn't enough of that specific antibody type for the test to pick up.
Precisely. It's like the test can't see it. And this is why the source really emphasizes that a test for total serum IgA levels should always be done at the same time.
Got it, to check the baseline.
Right. And if those total IgA levels are low, then doctors need to switch tactics.
Use different antibody tests.
Yes. Specifically tests like TTG-IgG or DGP-IgG, that's deamidated gliadin peptide IgG.
But this follow-up testing doesn't always happen.
Unfortunately, no. It gets missed. And that leads to people with coeliac getting a false negative result.
Wow. So someone could have symptoms, get a blood test that looks normal because of this IgA issue,
and then not get the further investigation they need.
That's a really significant gap in the process.
It really is.
The source also points out that even the biopsies, which are often seen as the, gold standard.
They have limitations too, yes.
How so?
Well, even with a biopsy, there's a chance of missing the damage. The damage to the intestinal lining, the lesions can be patchy.
So if they only take 1 or 2 samples,
They might just miss the affected areas. The recommendation is actually for multiple biopsies from different parts of the duodenum, that first part of the small intestine.
to increase the chances of finding something if it's there.
Exactly. And furthermore, and this is absolutely vital,
What's that?
individuals must be consistently eating gluten before they get tested, whether it's blood tests or a biopsy.
Why is that so important?
Because starting a gluten-free diet beforehand can completely mask the signs of coeliac disease.
It makes the test look normal.
It can lead to false negatives, yes. It makes getting a correct diagnosis much, much harder later on.
That makes perfect sense, but it's exactly what someone might do instinctively, isn't it, if they suspect gluten is the issue?
Absolutely. Cut it out to see if they feel better.
It's a real diagnostic catch-22.
It really is.
The second source also briefly mentions non-coeliac gluten sensitivity, NCGS.
Right. This is where people clearly react negatively to gluten.
But they test negative for coeliac.
Correct. They don't have the same autoimmune markers or that characteristic intestinal damage we see in coeliac disease.
So what's going on there?
Well, what's intriguing about NCGS is that the mechanisms aren't as clear-cut as coeliac. It's still a very real condition for people, though.
It causes real symptoms.
Oh, absolutely. Current thinking suggests it might involve the innate immune system, sort of a more general immune response, or perhaps imbalances in the gut microbiome.
So gluten can still be problematic for different reasons, even if it's not full-blown coeliac disease.
Exactly. Through different biological pathways.
Now, shifting gears slightly, our third source, Modern Wheat, Diet, and Coeliac Disease, looks at the bigger picture.
Right, like why coeliac might be more prevalent today compared to the past.
And it also looks at potential ways to support the body's healing process. It brings up some really interesting points about wheat itself.
It does. The source talks about how modern wheat breeding over decades has really focused on things like high yield.
Getting more crop per field.
And also the dough's elasticity, for better baking in industrial settings.
Okay.
But this selection process has, perhaps unintentionally, resulted in a significant increase in the gluten content of modern wheat varieties.
Compared to older types.
Compared to older, more traditional types, yes. And if you think about how much wheat is in our modern diet,
It's in so many things.
this increased gluten load could be a contributing factor to the rising rates of coeliac, at least in people who are already genetically susceptible.
And it's not just the wheat itself, is it? The source also points towards industrial food processing.
Yes, the multitude of additives that are now so common.
Like bleaching agents, emulsifiers.
Preservatives, and even enzymes like transglutaminase, sometimes called meat glue, which can be used to improve dough texture.
And the suggestion is that these substances could potentially be, making things worse.
The idea is they might amplify the immune system's reactivity to gluten in people who are sensitive.
That's a crucial consideration, the cumulative impact of all these modern food components.
On our gut health, our immune function. Yeah. The source contrasts this with older wheat varieties like einkorn or emmer.
Which have different gluten structures.
You're right, lower gluten levels, yes. And it also brings up historical food preparation methods.
Like sourdough.
Exactly. Natural fermentation, like sourdough, actually starts to break down some of the gluten proteins.
And other potentially problematic compounds in the grain.
Right. So the less processed nature of historical diets using these older grains and methods might be another piece of the puzzle.
Explaining why gluten issues might have seemed less common back then.
Possibly, yes.
So thinking about managing coeliac disease today beyond the absolutely essential gluten-free diet.
Which is the cornerstone, definitely.
What does this third source suggest in terms of other therapies, things that support healing?
What's encouraging is the focus on really nurturing the gut.
Okay.
A source talks about the potential benefits of probiotics and prebiotics.
To help restore a healthy gut microbiome balance.
Exactly. It also mentions L-glutamine. That's an amino acid that can help support the repair of the intestinal lining.
And dealing with nutrient deficiencies from the malabsorption.
That's key too. So supplements like zinc, vitamin D, iron are often beneficial.
Makes sense.
And the source also points to anti-inflammatory foods, things like turmeric, ginger, omega-3 fatty acids, maybe helping to reduce overall inflammation.
Interesting. And you mentioned medications.
It touches on an experimental drug, larazotide acetate. It's being studied for its ability to potentially reduce gut permeability or leaky gut.
But that's still in the research phase.
Still in clinical trials, yeah.
Yeah.
Not standard treatment yet.
Okay. And what about the big question? Can someone fully recover after a coeliac diagnosis?
The source is generally optimistic here. It suggests that for many people, yes, a full recovery is possible.
But it takes time.
It does. With strict adherence to the gluten-free diet, the timeline can vary, maybe 6 months, maybe up to 2 years.
Depends on the person.
Depends on things like their age, how much damage there was at diagnosis, and crucially, how consistently they avoid gluten.
Are there any long-term issues that might not fully reverse?
The source does note that some complications that might have developed before diagnosis, like significant bone loss, maybe some fertility issues, might be harder to fully reverse.
Which just underscores again how important early detection is.
Absolutely. Getting diagnosed and starting treatment sooner rather than later makes a difference.
Okay, so pulling all this incredibly important information together, if you suspect, listening to this, that you, or maybe someone you know, might have coeliac disease.
Yeah.
The absolute key takeaway, the number one message from all our sources is this: do not start a gluten-free diet before you get properly tested by a doctor.
Please don't. Doing that can seriously compromise the test results,
leading to false negatives, delaying the right diagnosis, delaying treatment.
That's the fundamental message. Go see a doctor, talk about your symptoms, and really advocate for comprehensive screening if needed.
Especially if the symptoms are vague or persistent or don't quite fit that typical gut picture we talked about.
Absolutely. Early, accurate diagnosis is step one, the most important step.
And it really makes you think, doesn't it? When you consider this complex interplay, our genes, our modern food processing, the challenges in diagnosis.
It's a lot of factors converging.
Right. So what other health conditions out there that maybe we think of as simple intolerances could actually have similarly intricate origins and might need a much more multifaceted approach to really understand and manage them?
It's definitely food for thought.
Indeed. Thanks for taking this deep dive with us.